Welcome back. Back pain is something most Americans will suffer from in their lifetime, and it accounts for 264 million lost workdays each year. That's why St. Luke's has pioneered a program to find what's wrong sooner. Director of Spine Surgery, Dr. Churig Upadhyaya at St. Luke's Marion Block Neuroscience Institute explains. How many people suffer from back pain?
About 80% of Americans at some point in their life will have back pain or leg pain with back pain, and so it's a very, very common problem. Sometimes it occurs for a few days, and sometimes it's a chronic problem that patients and people are having to deal with for a long time.
80% Americans, that is so many people, and I know you guys have a spine navigator system, and that can really help with the treatment. So can you explain that process and why it sets you apart?
Absolutely. So the challenge with patients with back pain is that sometimes they need to see a surgeon like myself, sometimes they need to work with their primary care physician or work with a musculoskeletal physician or a pain physician or even a physical therapist. So it can be very confusing to figure out where to go and whom to see first. So what we've set up is a spine navigator, which is a nurse who understands patients who have back pain and back pain-like issues and help direct them to the most appropriate provider so that patients can have the best chance of getting relief at a faster rate.
Okay, well that's amazing, because I know some people when they get treated, they might have to jump through a lot of hoops or a lot of tests before they can find the actual source of the pain.
Absolutely, and that's one of the problems we identified when we built our program here was exactly that challenge, to streamline the patient's experience so that they did not feel like they were bouncing around like a ping pong ball, but rather go to the first provider that can help take care of them.
Now, let's talk about people who may be afraid if they have back pain of back surgery. Is there any reason to be afraid?
Well, you never want to take surgery for granted. Our program is really built first on a conservative approach. So we always want to make sure that patients who go to the OR have done everything short of surgery before we take them to the operating room. But we've also built a program on the idea of really metricing ourselves and following our outcomes and having a group of neurosurgeons that specialize in spine surgery to help take care of patients.
Okay, and how has surgery changed in recent years?
The big advance that's occurred over the last decade or so has been the application of minimally invasive techniques to spine surgery. So years ago, when I was an intern, for example, patients would get big incisions like that to do even small surgeries.
Oh gosh.
And what we've been able to do now, and I'll show you here, is we do the surgery, many of them, not everyone, but many of the surgeries through small tubes like this, where we go directly to the problem level and address it. So if you have a herniated disc, we go right to the disc to go ahead and take that out. And to give folks at home a sense of the scale of what I'm talking about, this is a nickel, and you can see here that if you cover the whole of the this tube that I've got, it's actually smaller than the diameter of a nickel.
And you guys are also a spine center of excellence. So what exactly does that mean, and how does it make you better apt to treat people than maybe somewhere else?
So what we've done is we've applied a multidisciplinary approach that I've described for taking care of patients, and all of the surgeons that help take care of patients with spinal pathology are fellowship trained, which means that all of our neurosurgeons have taken an extra year of training beyond their residency so that they can enhance their skills and really have a focused practice on patients with spinal pathology who need surgery.
If you're suffering from back pain or would like more information on what can be done, go online to stlukescasey.org/backpain.